share my screen now. So basically in this scenario, why we have done it, this scenario again. So basically it's a type of atypical chest infection. So how we would be doing it. So yesterday, I think you have done this sketch. Yes. So let's quickly go through this. What are the point in these scenarios? How will you take the cough history? So always remember, if somebody is coming with cough, do the triad, shortness of breath, or problem breathing. Don't say shortness of breath and asking that. So somebody saying, okay, you mentioned that you're having cough. Can you please tell me more about that? Is that productive or dry cough, or any blood coming out of that? Or you said it's a phlegm? Then ask about color, consistency, how long you're having, suddenly or gradually, moves elsewhere, change over time, anything make it worse or better, and you will give options about that. Triad, chest pain, problem with the breathing, and cough already. Fever, weight loss, lumps and bumps, sweating. You can ask about that. You can ask about chills. You can ask about night sweats. You can ask about vomiting, or few of the whatever you could be able to do that. But first of all, if somebody is going to say, I don't want to stay in the hospital, you need to resolve that issue. If you don't resolve that issue, that patient won't let you finish till end. Okay. So general background wise, you need to ask about signposting, think about general health, non-allergies, medical history, family history, where do he live. So you can ask about where he live. He's homeless, okay, and he's doing drugs. So when you would say that, so the problem is that, Mariam, so you had to explore that why he want to go home, what he need, tell them, you can share with me. So you would have offered confidentiality in the start, then he would have told you that I need my drugs. And that you would say, definitely, will you, when I said, will you give me that? Then you would say, definitely, when you will say, we will be able to give you something different, similar to that, but something different. Okay. Similar to that, that when you're talking about antidote or something. After that, you will say, have you given a thought? What's going on? You skip the eyes because there was quite a lot of things going on. That's why you couldn't. So I will quickly look, listen, and feel your chest, and I'll send infection marker. I'll do chest X-ray. I told the patient is using 4. That means that patient need to go stay here. But definitely, patient has capacity. You can't keep him in the hospital. You can't say we can't let you go. So how you can let me? So that sometimes they get angry, but sometimes you need to explain that. Explain the findings, give diagnosis, chest infection, a typical chest infection, explain findings first, double check patient understand, then come to characteristic approach in which you will say, okay, we need to keep you in the hospital. Why? Because we have to give you antibiotic, because your chest, your X-ray shows your breathing is not good, or we need to keep you according to the curve scores. News is for not patient is not stable. When you tell them we need to there shouldn't be camera test or something like that. It's only I will remove it. So X-ray will do it. We might give you IV fluids, antibiotic through your veins, resolve drug sedation issue, offer services like methadone. Is the methadone is antidote of heroin or cocaine?
I'll have to recheck.
Sorry?
I'll have to recheck.
Yes, please recheck it. Maybe I just out of my mind. That was I think heroin or methadone. So anyone write in the chat box. It's not in my head.
Yeah, so it's for heroin.
Yeah, that's fine. So I was just wanted to double check that I'm telling you right thing or wrong. DP to social services, accommodation service. I told you I'm homeless. You didn't. You have to. Okay, let's try it one more time. Let's try one more time. Who want to be simulated? Ramesh or Mariam? Mariam, this is your time. You can pull your. You can now. You have a chance that you make me tough. You give me tough time the same way. Now, but I will tell you guys. You have to score me how, and how to simulate with Mariam. If I offer you confidentiality, then you will tell me about your drugs. Okay.
Okay. Yeah.
If I don't offer you confidentiality, you will. One more thing I want to tell you guys. Where I am. I'm here. One more thing I want to tell you guys. Refusal structure. So in refusal structure, basically, you need to explore the reason. Then you need to tell the benefits of giving treatment, and then side effects of not giving treatment, and assessing capacity. So you need to check the capacity. So I remember when last time Dr. Abdullah, Dr. Faizan explained about how to assess capacity. So I will try to give everything what I could. I'll try my best. So, but still, you can score me 3, 2, 4, 5. I don't care. But I want to try here. Okay. So I'm going to put the timer on for myself, and the patient name is what's the patient name is? Michael
Brown.
Sorry,
Michael Brown.
Michael Brown. Okay, and you are homeless. You want to go home because you need to take your drugs. And if I'm not good, I'm not polite if I don't offer you anything similar to drugs. You
He's
don't.
homeless, then why is he going to go home?
Yeah, I remember. I remember when I was simulating this scenario, one of my the student, he literally said that you want to go home, you want to go home, but you said you are homeless. I said I mean my friend's home.
All right. Okay.
Because the homeless usually sleep around anywhere,
Yeah.
something like that.
Yeah, sure.
So let me put the timer on. Okay, just let me get the timer. Okay, enter the room. Hello, I'm Dr.
Hey.
Gafar.
Mm-hmm.
It's Michael Brown.
Yeah, that's me.
Hi, Michael Brown. I'm one of the doctor here in A&E. I want to help you today. Could you please confirm your date of birth for me?
Yeah, so it's 17th August, 1998, something, yeah.
Thank you very much. And nice meeting you. Welcome.
Mm-hmm.
And I'm all here to help you. Can you please tell me what seems to be the problem today?
So I've got this cough, just fix it.
Cough. You're having cough. Okay.
Yeah.
Can you please tell me more about this cough?
Uh, yeah. I'll just fix it and let me go home.
Yeah, definitely. I need to ask you more questions. Definitely, nobody want to stay in the hospital. But I'll quickly ask you questions, quick examination, and make sure that you're safe to send home. Will that be okay with you?
Yeah, just ask questions. Yeah.
Yes. Okay. Quickly ask. Can you tell me more about the cough? Are you bringing up anything out of it?
Yes, it's not dry. It's got phlegm, sputum. Yeah, so it's white in color. It's coming there since it started, and it's getting worse.
I'm sorry to hear. You look little out of breath as well. Definitely, I'll make sure I'll provide you help. And you mentioned that it's a white phlegm. By any chance, have you noticed any blood in that?
No.
And how much it comes up when you when it's come up like amount wise?
What do you mean?
Like a amount, like a cup of tea, or how much it is when you cup up?
No, like a teaspoon maybe?
Okay, teaspoon. Right. Apart from that, have you noticed you're running any temperatures?
No, I'm not noticing anything. Just fixing me and I want to go home.
Oh, you're very keen to go home. Definitely, I would.
Yeah.
Tell me the reason why you want to go home.
I've got some things to do. That's it.
You have some things to do.
Yeah,
Okay.
they're important.
I might help you with some things you can share with.
No, I'll do it myself. Yeah, I need to be back home.
Definitely, but I would like to tell you, if you want to share anything with me, you are at a very safe place. I'm a doctor, health professional, and I'm going to help you with anything, and it would be confidential between you and me and our team.
Well, I just I need to do I need to take a shot of heroin.
Oh, all right. So
Mm.
you're using heroin. Okay.
Yeah, yeah.
So definitely, I'll come to
So I
that.
need to go and just fix it, and then I just need to go.
Oh, definitely, you mentioned that that makes sense that you're taking heroin and you need it.
Yeah.
If I tell you that I might help you with that, might be giving you some substitute for that, the similar to heroin that would help you.
So you're telling me that you'll be giving me heroin in the hospital?
Oh, no, not specifically heroin, the treatment for the heroin.
I don't want any treatment. I just want my heroin.
Yeah, definitely. Can I quickly ask a question regarding your cough problem? Then I'll come back.
Yeah, just fix
Yes.
that. Yeah, yeah.
Okay. You mentioned that you haven't noticed any fever, any lumps and bumps in your body.
No, I'm not noticed.
Okay. Any problem with the light and foot?
No, no,
Light hurting you? Okay. Any pain in your neck at all?
no,
No. By any chance, you vomiting as well?
no.
Any pain in your tummy?
No, it's just the cough, doctor.
Only
Come
cough.
on.
Oh,
Yeah.
any chest? I'm sorry. Any chest pain along with that?
When I cough a lot, then I get some. Yeah.
Okay. How the pain is like? Is a sharp pain or something?
No, just when I cough really hard, then it's the
Okay.
pain.
Only during the cough.
Yeah,
Okay.
yeah.
Well, thinking about your general health, are you fit and well generally and medical condition?
I don't know.
Okay. You don't, it's okay, no problem. Any allergies do you have?
No, when's the question gonna end? I need to go home.
Definitely, just few more questions, and definitely I'll tell you what I can help you with the heroin. I do understand you
You're
need.
gonna help me with the heroin?
We can offer you something similar to that. We call methadone. That will help you with the symptoms you're going through at the moment. Will
Okay.
I can arrange that for you. Is that okay with you?
Yeah, I just want to get fixed.
After
Yeah.
my question, I can ask the nurse that will bring that and will keep you here.
Okay. Just ask questions.
Okay, so at this point, I would like to ask, what do you do for a living?
Well, I'm homeless. So nothing.
Or definitely you might need some temporary accommodation as well. I'll try to sort this out. So Michael, you mentioned that's been going some long time. Have you given a thought what could be the cause?
No, just fix me, doctor. It's driving me crazy. Come on.
I do agree. I'm sorry. It must be affecting you as well. Definitely, you're coughing a lot. At this point, I would like to check your observations.
Yeah.
And your oxygen saturation. I'll quickly listen to your chest. And after that, any finding?
88.
Okay. So, Michael, at this point, after having a chat with you after my assessment, I'm thinking you're having a chest infection, and which is not a typical one. It seems like something different compared to the normal chest infection called
Well, I
PCP.
don't care what that is. Just fix
You're
me,
very
and
precious
then
to us, Michael.
I need to get.
You're very precious to us. We make sure we treat you well. Okay. So we call it
Yeah.
PCP. For now, we need to keep you in the hospital. I'm sorry for that. Is that
Well,
okay?
I can't stay in the hospital for
But if we
obvious
arrange a
reasons.
methadone
I
for you,
can't.
you'll be able to. If we get a similar thing for you, you'll be able to do that. You
So
will,
it's similar to heroin, yeah?
yes, similar to that. But it
Okay.
helped the treat the symptoms.
But what if it doesn't work? So will you be arranging heroin for me?
I can't do that because drugs are not allowed. But at the moment, we need to give you antibiotics through your lines. Make sure you're okay. We'll give you some IV fluids and we'll keep you for a while. That will get better. Okay with you. In the meantime, we'll start you on the treatment for that the heroin cessation.
Why did I get the chest pain, the chest infection? Why did I get this?
You might have got through because I had to ask you a question about your drug history because you might be injecting that through needles, isn't it?
Yeah.
So there is high likely that you might have got this infection because your immunity is gone down, and we need to run a few more tests to check your immunity level. Some problems related to the infections like hepatitis B. Okay. To the next station. I couldn't done it myself. So that was it's a hard patient anyway. Well, yes. So Mariam, debrief it.
All right. So, well, I was being really a jerk, to be honest. But yeah, so you did really well. You really calmed down. You knew what you want to do. So that was a good thing. And then you were not in any like kind of way that you were judging. So that was a good thing. Obviously, when you're in a situation which there's a lot of like the way you want to negotiate with the patient, you tend to lose what you are going through in a track to like ask a few questions. Like in breathing difficulty could have been asked really earlier, and then the saturation levels because she was struggling anyways. And yeah, sexual history was important as well, and the drug history. When one mentions drug, these two could have been there as well because the idea, homeless, drug users, just go with the flow with the sexual history and might just omit the other part. Yeah, and a few questions, I think light sensitivity, I don't think so that were important in terms of the cough. But yeah, so all in all, you kind of agreed me to stay in the hospital, and then so that was the main thing, and also admission and antibiotics. So it was a good one. I think a 9 or a 8 maybe. But yeah.
All right. Thank you very much, Ramesh.
No
So I'll
worries.
try to improve this next time. So yeah, Ramesh, do you have any point to say? Is refusal case or just a PCP? It contains refusal. It contains a refusal, part of refusal where you say, I want to go to home. So refusing admission. But if you provide him methadone, he would be say, okay, thank you, doctor. And yes, it usually happens. So somebody is coming to hospital with the alcohol withdrawal symptoms, they start shaking, and we give them any chlorodiazepoxide. Probably next they say, okay, thank you. So this is how it goes. Anyway, Rameshat, you want to say anything about that? Or Adam? So we'll have to cover quite a lot of other things. Sorry?
You did everything right, and the part where you offered temporary accommodation, that was a good point as well for the homeless person.
So
I
was
thought
trying to
you would
do,
miss
the
it, but
thing
you
is,
did it.
the point which is if sometime patient says that I want to go home, so add some idea, say that you are very precious to us as a team or something. Try to use we, us. Don't say trust me, because I remember I was giving mock to one of the doctor in my PLAB time. I said, trust me. He said, you are talking like you're talking to your girlfriend or wife, trust me. It's like it's like more something like that. So yeah, so try to be more using we rather than I, and try to build rapport with the patient and try to be sweet when the patient get angry. So try to be very sweet. Thank you. So we'll move to the next from the Ramesh. So what was the second scenario you was doing? I have to do that, or you have to?
You had to do that one, and
Okay.
it was
Okay, tell me a
atypical.
story. Tell me. Let's try it. Tell me a story.
It's for atypical pneumonia.
Okay,
So
this is done.
yes,
So let's
that
do the. We have done it. So we'll do another one from any other
oh,
symptom.
you can do
Let's
any.
do. Yeah. Do any scenario from. Give me any scenario from refusal structure. Any refusal structure, because I want to show students how to do the refusal structure. Any scenario from the refusal, and Mariam would be doing the examiner part. Then I'll tell you how to do the refusal structure, and then after
Okay.
that we'll move to the further part. Refusal structure. Any scenario from the refusal. Ramesh is going to give the refusal structure, and Mariam would see that. And I want you guys to see that how the refusal structure is being done. And right after that, we might give you break. After this scenario, I'll give you break because that would be a lunch break, and I will be doing a refusal scenario, and after that, I'll be giving a break. Ramesh, you still here?
Yes, I'm here. Just a minute.
Okay,
Let
you're
me.
trying to find a refusal. Try something tough, so that I will make
That
some
is
mistakes, and student will learn from my mistakes.
okay.
So every day I was speaking to Radwan. So we will be introducing, apart from the days we are doing, we do one difficult approach, which one is refusal one. So today that was the refusal one, which came into the PCP scenario. So I'm doing another, and then tell you how to approach the refusal station.
Okay, fine.
Okay.
So you are in FY2 in GP oncology.
FY2
In GP oncology.
oncology.
Yes, and a 75-year-old man was admitted yesterday with neutropenic sepsis.
Neutropenic sepsis. Okay.
Yes, and he was diagnosed with non-small cell lung cancer, and he is on chemotherapy. He has received 3 cycles of chemo.
Okay. Oh,
And
Ramesh, can you?
yes,
Okay. You just need to give me the information which is outside. The rest of the
okay,
information, tell me when I will ask.
okay, all right. Okay,
This
so
information would be outside the cubicle.
okay, so it's an FY2 in GP oncology, and you have a 75-year-old man, and he has neutropenic sepsis and is on chemotherapy.
Okay. Okay, all right. So let me repeat the scenario. So I'm FY2 in the GP surgery. I'm about to see a 75-year-old patient who got neutropenic sepsis, and he has a lung cancer. And I am going to see this patient. I'm outside the cubicle, hard and scared. I'm thinking now about this scenario. Okay, I'm outside the cubicle. So I will be thinking like, okay, I'll take full time. Okay, I'm
Okay.
outside the cubicle. I'm outside the cubicle. It will tell to begin. I'm thinking. I'm outside the cubicle. So neutropenic sepsis. 75-year-old GP setting, oncology. Hold on. Okay. All right. Start. Enter the room. Hello.
Hello.
Hi. Hi. I'm Zeeshan, one of the doctor here. Is this Michael Brown?
Yes, it's Michael Brown.
Nice meeting you, Michael Brown. Is that okay? I call you Michael.
Yes, it's fine.
Okay. Before I proceed, can you please confirm me your date of birth?
Well, it's 20th February 1980.
Thank you very much, Michael. I understand from my notes that you've been here in the hospital. Recently, you've gone through some of the chemo, and you've gone through going through something. Can you tell me more about that?
Well, yes, I've been diagnosed with this lung cancer. And yes, doctor. And it's been like almost an year, and I've been taking these chemotherapy sessions. And every time, doctor, whenever I go through these chemotherapy sessions, I have this episode of fever and so high spiking fever that I cannot explain, and chills and everything. I get really very, very worried that why am I having this episode? And the doctor says it's some kind of sepsis, and I don't know what to do. I don't want to go with the chemotherapy anymore.
Yeah, that makes sense. I'm sorry. I'm sorry you've been through all of this experience. First of all, I would like to tell you that you are very strong and brave. You're going through this, and definitely I want to listen to all of your concern, and I'll try my level best, whatever I can help you, and I'll speak to you about chemotherapy. And but before that, I need to know a recap of your this time previous consultation with the chemo doctors. How many times you went there, and tell me a little more about that.
Well, I have these 5 chemotherapy sessions, and every time I came back to the hospital after the chemo and have this admission, and I'm over to the hospital, and they are giving me drugs and these antibiotics.
Oh, I'm sorry to hear about that. So every time, what symptoms you get? Like you get fever, apart from that, anything else?
Yes, I get this fever and these chills, and other than that, I also sometimes it's very difficult for me to pass urine as well,
Mhm,
and
mhm. Yeah.
that's why
And
my heart it beats very fast, and my
mhm,
pulse gets fast
mhm.
sometimes it get lows. So these are the things I
Yeah,
am
just
facing.
yeah, every time after your chemo session, have they told you about the complication of chemotherapy itself?
Well, yes, they told me that you are going to get sick sometimes, but it happens every time, and now I'm just tired and done with it. I don't care. I can die with the cancer, but I cannot come to the hospital and go through this now.
Yeah, that makes sense. Anyway, but sorry to asking you these questions again and again. Have they mentioned that if they stop doing the chemos, what could happen or something like that?
Well, yes, doctor, I already know chemo is for my cancer, and if I don't get the treatment, then maybe I'm going to die.
Yeah, yeah, that's a brave sentence from your side, anyway. But let's talk a little bit more about it. Okay.
Okay.
So, whenever you come to hospital, do they keep you in the hospital for antibiotics and stuff and everything?
Yes, I've been here 4 times, and this was just one time when I was discharged home on the same day, and I got better. But
Uh,
every time I come to the
okay, so
hospital, and
you have issue with the chemo or staying in the hospital with antibiotics only, or just only with chemo?
well, I have issue with getting sick every time after the chemo
Oh,
session.
okay, okay, that makes sense. Anyway, no problem. So, Michael Brown, I understand where you're coming from, and I do respect your wishes as well. Definitely. At this point, because you got a recent chemo, I'm a bit worried about you. So I just need
Mm.
to quickly assess you further, ask you a few more questions. Any tummy pain at all?
Sometimes I have the tummy pain after chemo.
You mentioned burning pain as well.
Yes, I have this pain.
Okay, on your okay. So I would like to quick examination of your tummy. I will do a urine test for you. I'll send some blood investigation to see that, and I know that you're going through a neutropenic sepsis. So I would like to explain you what is neutropenic sepsis is. Can I explain that to you?
Okay, all right.
Basically, neutropenic sepsis is a condition after the chemo. Your blood, one of the count of your blood, get very low. And it is
Mm-hmm.
very potentially dangerous situation. In this situation, usually we need to treat you with antibiotics. That's why we keep you in the hospital. So to make sure that your overall your body functions don't decline, and that's why we keep you every time in the hospital and start you on the antibiotics. So I would like to advise you at this point that we treat you for this potentially dangerous situation at this time. Is that okay with you?
No, doctor, I'm done. I don't want to get the treatment. I don't care whatever happens. I don't just want to go with the treatment anymore.
Okay. So this time you don't want to get the antibiotics done.
Yes.
Okay. And do you know that if we treat you now, and what would happen? Like you'll be able to go home soon as well. Do you know that?
Yes, I know, but doctor, I don't care really. My wife died 6 months ago, and
Oh,
I'm alone, doctor, so I don't care even
such a
if some.
loss, such a loss. I understand now. Uh, what we can do for you now that as it's potentially dangerous that I'm afraid that we don't give you antibiotic, you might die of infection because your body is more prone to infection at the moment.
Yes,
Will you
doctor.
consider that this time?
Yes,
Because you are
doctor.
precious to us. Please, would you consider that?
Yes, doctor. I just want to go home. I don't want to get the
I
treatment.
do. So I need to think alternate plan so that we get antibiotics at your home. Is that possible that we get antibiotics at your home? We'll speak to the nurses that they can provide antibiotic at your home, and in that case, will you able to get the antibiotics?
Okay, I can maybe think about it if you
Yes,
went
yes,
home and
yeah, we
give me
can
the.
do that. Because we need to get an alternative plan for you because I'm afraid that this infection might be very potentially dangerous for you. And regarding your concern of not having chemo again, you can discuss with your cancer specialist, and they would give you better advice for that. And I do respect your wishes. Okay.
Oh, okay.
Thank you. Bye. So, guys, yes, Ramesh, you debrief yourself first.
Yes, you did it perfectly well. Like you offered the alternative treatment in the end, like at home. I was expecting that when you would say this, so you got there in the end.
So basically, the thing is that I'm not gonna tell him to go home, because the whole trick in this scenario is that if somebody, definitely you know that neutropenic sepsis is going to kill someone,
Mm.
and you are a doctor, and if you don't have skills that you stay in the first line or the first sentence, okay, go home, you have capacity. I did asked the question where I was assessing the capacity. I said, Michael, you know that if I don't give you, might die. That was the way I was assessing capacity. He said, I know. Then the main thing I was trying to find out, do he have the problem with the chemo or antibiotic? Definitely he has a problem with antibiotics or staying hospital. So what, because mostly the people, old people don't like hospital. They want to go home. And recently gone through like it happened. It's a real, in real life, I do say, the people, they stay together 40 years, 50 years together. And after that, they want to die. They just say that, just kill me. So they say that. And he said that, I don't like hospital for now. My love of my life already died. I don't want to stay in this world anymore. But it's your way that, first of all, you tell that benefits of giving treatment, then you'll come to that side effects of not giving treatment. First, you will explore the reason. You'll try to take the data gathering part. And then after that, when you have explained everything about that, then you come to the point in which you will say, okay, let me think of alternative plan. Still, they don't want alternative plan. Then I need to speak to my seniors. Still, I won't say, okay, I will sign it, because this is potentially dangerous situation. And the similar case scenario in which there is a decay. If the case is like, if like 33-year-old female come to me and she had just a headache, 5 out, it's not a banging headache or something, or maybe just a sprain, or she says that this, I say, okay, you have capacity, just sign this form and go. But here in this case, condition was serious, so I would go till end and offer alternative. If they accept, okay. If not, then again say, we need to take some time, let me speak to my senior. At this point, I'm afraid I need to ask my senior to have a chat with you before I send you home. Yes. So after the break, I'll come back. It's 1:50, so I'll come back at 2:40. Okay, 2:40. I'll come back. So I'll finish at 6 o'clock. So that 2:40. Ramesh, that's fine. Thank you very much. You don't need to go after that. And Mariam,
Yes.
you as well, because another simulator will be
Thank
coming.
you.
A doctor will be coming. You both. Thank you very much, both of you. Good luck.
Nice,
See you
thank you.
hopefully tomorrow. And we'll
Inshallah.
be having 40 to 45-minute break. And see you guys soon. And share this link to anyone who's going to the PLAB too, because this might be last free day, or maybe after that. We were thinking to make an open day. Just we are sending to everyone to have an open day, see what we are doing. And possibly because this is our full course, we got a lot of people there who are taking the full course. So we are planning to make it open day for first 2-3 days, tomorrow as well. So after that, we will maybe restrict it to the people who are. But I really wish that I could do everything for free, if I wouldn't have to do any pay rents or anything. But at the moment, yes, I want to help everyone, but I want to do it in minimum cost for everyone, cost effectiveness. All right. See you guys. Take care.
Thank
Bye.
you. Bye.